We are doing this mole excision. You don't feel anything, right?
Mm-mm.
Good. So this mole is sitting in the forehead area, and the key with this is to make sure that you select a mole that A is not a cancer. If something is rapidly changing or bleeding, then I don't take out cancers. I would send it to a dermatologist or a Mohs surgeon. This is a lady that's had this all her life, so it's not something I'm as worried about. But if something is changing, turning color, bleeding, then it's more alarming. If it is a cancer, she would have to go and have a wider excision. Now, I am always going to send this for pathology, so I'll know if it is or not. That way, if it is, then she can do a more proper excision, which is a wider margin, or a larger incision. When I'm excising this, the other thing that's important is I always say let the punishment fit the crime. I don't cut out every mole. I only cut out moles that I feel as if are justified for this excision. So that's the second rule. The next thing is to make sure patients know, let me use a 15, that patients know that the incision will look worse before it looks better. And I always say the two things that make a good result is good surgical technique and good aftercare. So let's talk about each of those and explore that concept a little bit more in depth. The good excision, first of all, is marking out the incision in a way that looks natural, that will heal well. And so I do this in a relaxed skin tension line. And doing it in a relaxed skin tension line means it heals better. Our collagen bundles are in a way, let me just get rid of this resin. Our collagen bundles occur in a direction on our face, and if you violate those relaxed skin tension lines, you don't get a good result. It can heal poorly. Second thing is a tension-free closure. So what I'm doing right now is undermining this area so that there's not tension on the wound when I close it. Well, the key with the surgery, I'm not really showing a lot of the cutting. I know people like gory things, but I'm not a big fan of it. So unfortunately, you can go find another web channel that shows more tasteless surgery. I'm more about really explaining to you what I do and what I do differently. So what I'm doing right now is I'm really releasing the tension. So I'm really taking my time before I do the full closure, and there's still a little bit of tension on there, 15. And just releasing the tension on the incision. That's so important that there is no tension on this incision. So where I feel the tension, I'm releasing it, and before I make the final closure. So right now there's still a little tension on the incision. I look at where I have not undermined. I do so. Not feel anything?
Mm-mm.
Good. So relaxed skin tension line, tension-free closure, and multi-layer closure. So I do a deep closure and a superficial closure so that there is no tension on the wound. What's interesting, over the last, I've been in practice 20 years. The last 5 years, I have changed how I approach a mole and many things. And it started, interestingly enough, when I was lecturing in Russia about 6 years ago, where I was hearing for rhinoplasty closures, people were using a dissolvable outer suture, and I was shocked at that because, 5 more sec, please. Actually, I'll take the time. This is perfect. Using a dissolvable suture, and I was shocked at that because I was told that would leave track marks behind and it wouldn't heal well. And I was using a very long-lasting deep dermal suture, that is a deep buried suture, because I thought, hey, I didn't want spread back. But what I found was quite the opposite, that the long dermal sutures sometimes could spit and cause problems. So I've actually reduced the number of deep dermal sutures, and I've actually used slightly shorter lasting dermal sutures to minimize that. When it comes to epidermal sutures, I've found the opposite. The longer lasting epidermal sutures, if they're chosen well, this vicryl, very, very fine vicryl, actually causes less of an issue because it doesn't cause track marks, and when you can hold the epidermis, the outer layer of the skin, longer together, you actually get better healing. Sounds crazy, but it's actually the truth. So I've gone from long dermal, short epidermal, to long epidermal, shorter dermal, and fewer dermal sutures. And I've found the incision to be better. This patient has also been pre-Botox. So what that means is, a few weeks ago, she's had Botox into the forehead, not just for wrinkles, but it also helps with the healing of this incision. Now, why is that? The reason is that Botox actually relaxes the muscle from stretch back. Remember, stretch back is your enemy. But it also, in double-blinded prospective randomized controlled studies, have shown to have benefit for wound healing. They did a study in the neck where half the incision was injected with saline and half the incision was injected with Botox, and they found the side with Botox healed better in a blinded analysis. The second part of the equation that I mentioned to you was really is giving it the right attention post-operatively. So a lot of times post-operatively, we just say, well, you did a good surgery, we'll let the patient go. But this is why I do not like doing moles for patients from out of town, because this can take 5 or 10 visits. It can take a dermabrasion, and dermabrasion is not what you guys are probably thinking about. It's not like what you get at a spa. It's actually a mechanical flywheel that sands down the outer skin to make the edges look good. It may require some post-operative additional Botox, maybe some 5-fluorouracil, which is a scar dissolver if some things don't heal perfectly. And if you do all those little treatments with a good surgery, you get very good results. You can get very good results, and of course you choose the right patient candidate, give them the right expectations, and do the right surgical procedure. So this procedure will continue. Don't have a lot more profound things to say. I encourage you to watch my virtual consultation on mole for more details, and some of the points I've already mentioned will be reiterated. So hopefully you've enjoyed this little discussion where I'm in the middle of operating and just telling you some of my philosophy and thoughts about moles.